Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, not in the studios not in downtown Lansing either, out at the airport, at the Capital Region International Airport. We're right there in the lobby broadcasting these days, but today I'm a little remote here. But so is our guest, Brian Peters, CEO of the Michigan Health and Hospital Association, or MHA. Brian, it is always good to have you on, and you're always newsworthy because there's something in your industry happening about every 28 minutes.
Well, Chris, always great to be with you. And you're right, healthcare is a venue where there is constant change and there's always a new challenge, but also lots of good news, lots of miracles that occur in our field every single day.
You know, it's interesting because what has crept up again in the last couple Michigan Future Business Indexes is the cost of healthcare. And so I know how busy you are and on your advocacy, looking at legislation that doesn't hurt the healthcare industry, et cetera. So there's some major work ahead yet for you to do, right?
Well, there really is. And now that this new legislature is up and running, and committee hearings are beginning in earnest, and there's been a lot of activity. We certainly are going to make our voice heard about the challenges that hospitals and health systems throughout the state of Michigan are dealing with, and they're real. And the financial viability of our members is absolutely front and center right now. We have to make sure that we're adopting good public policy that supports our hospitals. We want them to be there for all of us when we need them. And that's a very, very important priority at this point.
Well, the other thing I found interesting, because I generally speaking, in the last 10 of the last 11, I've been on the floor for the state of the state, and I was amazed at how few people I knew, which speaks a little bit to your ongoing task of not only educating, but just familiarizing yourself with new folks moving in and out.
Well, you're right. I mean, 59 new lawmakers to be exact. And those are folks who, in most instances, don't have a solid understanding of the Michigan healthcare ecosystem. And it's our job, it's incumbent upon us to help educate them and make sure they understand the things that we're dealing with and what we need from our elected officials. And I'm very optimistic and confident that we'll be able to do that. It's a good class of folks, and we look forward to working with them.
Well, you've done a great job over the years. I don't know why that would change. So I understand that last Wednesday, Brian, in the midst of all this, the Michigan Health and Hospital Association, its member hospitals and health systems contributed more than $45,000. Tell us a little bit about that.
Well, that's right. In fact, it was the same day where the governor delivered her State of the State address. We were in the Capitol building earlier that afternoon with the Food Bank Council of Michigan. This is continuing a longstanding tradition where the MHA and our member hospitals throughout the state, we have always supported the Michigan Harvest Gathering. And this is a initiative that Bill and Cynthia Schutte many years ago, it was their idea to launch this very robust food gathering effort. And we did support this effort in 2022 to the tune of $45,000. The MHA presented a check in the amount of $30,000 at the event to supplement the $15,000 raised by our members. So very, very proud to do that, to provide fresh, healthy food to those in need.
Well, and of course, Dr. Phil, head of that Food Bank Council, longtime friend and also a broadcaster here on this network for a while. Tell me a little bit about your history with it. And I know you touched on it, but this is not your first pairing up with the food bank.
Right. We've actually been a signature sponsor of the Michigan Harvest Gathering for 25 years. And the reason is very simple. The mission of the Michigan Health and Hospital Association is to advance the health of individuals and communities. And with that, we understand that it's critically important that all Michiganders have access to fresh, healthy food to help prevent an unnecessary trip to the hospital emergency department or worse. And we've seen the positive impact that the Harvest Gathering can make in our communities, and this is true whether you're talking about rural Michigan or urban Michigan, there is not a corner of our state that is unaffected by the issue of food insecurity. And Chris, the reality is the pandemic only made this situation worse. There are more Michiganders than ever before who have to concern themselves with where their next meal might come from. So again, this is a perfect fit with our mission. We want to make sure that all Michiganders can be as healthful as possible. Food is critical in that.
Yeah, it's interesting. So my next question, obviously, is how big a deal is this issue? Because we do know that access to healthy food is a tremendous preventative.
Well, it really is. And the reality is food is medicine. We know that there are a growing number of clinicians, both here in Michigan and across the country, who are prescribing specific foods to their patients because they understand a unique healthcare related issue that they might have. And rather than simply prescribing a medication or some sort of inpatient procedure, food can be a huge piece of the puzzle when you talk about maintaining wellness. And so we've looked at the science of this. Our clinicians understand the science very well. And so we're dedicated to being a part of this solution.
Well, Brian Peters, CEO of the Michigan Health and Hospital Association, MHA, thanks so much for being on that side of the wellness piece and your continued support. And great to have you on here again. And we appreciate your time, Brian. You've been watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman.